Good afternoon. My name is Mariana Mateus. I am a physiotherapist specializing in the treatment of adults with neurological disorders. Firstly, I want to thank you for the invitation. It's a privilege for me to be able to share my work with you. I apologize because my English is not perfect, but I will do my best. The title of my work is Physiotherapy Case Reports on 3 People with Progressive Supranuclear Palsy. As we know, neurological disease involve various motor change, such as muscle weakness, impairment of balance, increased risk of falls, decreased movement and coordination, gait change, and consequently reduce functional independence and lower quality of life of this patient. Evidence indicates positive effects of exercise on brain health, maintaining optimal cerebrovascular function, and potentially preventing cognitive impairment. In these disease, physiotherapy should be recommended at the time of the diagnosis, but it's something that doesn't happen in most of cases. PSP is a rare progressive neurological brain disorder that is the most frequent form of atypical Parkinsonism and involve motor and non-motor symptoms that contribute to a lower quality of life of this patient. There is no cure for this disease, and the initial treatment approach involves medication combined with a multidisciplinary intervention. In more advanced stages, palliative cares become necessary to improve quality of life of these patients. This case series aimed to contribute to the understanding of PSP by describing three cases and their clinical evolution following physiotherapy. This table represents the socio-demographic data of the participants. The study involved 2 women and 1 man, ages between 68 and 77 years, with no family history. The first 2 cases underwent physiotherapy for 4 years and the third case for 7 years at the moment. Patient 1 and patient 2 unfortunately died after a respiratory infection and aspiration pneumonia. All the participants have a good support of their family and they are involved in their intervention. The initial examination revealed that in the case 1, the motor symptoms englobe global bradykinesia, muscle stiffness, postural instability with a history of falls of 8 times per week, gait disorder, freezing episodes, balance impairment, weakness and postural changes, and a moderate dependence in daily life activities, and with no motor symptoms, he has anxiety. In case 2, bradykinesia, muscular stiffness, gait disorder, balance impairment, weakness and postural changes, sedentary lifestyles, decreased tolerance for exercise, and with no motor symptoms, anxiety, apathy, and fatigue. In case 3, she has bradykinesia, muscular stiffness, gait disorder, balance impairment, freezing episodes, and with no motor change, anxiety. Physiotherapy was adapted over time to suit the patient involved needs and limitations, and it includes gait training with dual task, music cued movement for the episodes of freezing episodes, balance training, resistance training, treadmill training, aerobic exercise, fall prevention education, functional mobility training, like sit to stand, mobility in bed, up and down stairs, boxing, and dancing. Several family sessions were conducted to encourage home exercise, provide for managing freezing episodes, along with safe walking practice. As we can see in this table, during the first 2 years of the physiotherapy, the patient showed improvement in their balance, in the response in the push and release tests, in the time of the walking, and a decrease of history of falls per week. Unfortunately, after 3 years of the physiotherapy, we know that are a decrease on the motor function, and in the case 3, the multidisciplinary intervention proven to be fundamental. In PSP, physiotherapy intervention is a challenge because at the moment we don't have clinical guidelines for the intervention with these patients. But we know the factors that positively contribute to the intervention, that are the time to initiate the intervention. It is very important to initiate in early stage of the disease. It is important too that the exercise is sustained and intense in the week of the patient and involve a multimodal training because there are various motor changes in these patients. The intervention needs to be personalized to the needs and limitation of the patient, and the involvement of caregivers is very fundamental to decrease the burden of the families. It is necessary a multidisciplinary approach, and the communication with neurologists is very important to do a global work with her. On the other hand, they have negative factors that contribute to the intervention, that communication difficulties, cognitive impairment, dismotivation, and impulsivity that is visible on the 3 cases in this study and contribute to the increase of risk of falls and a negative impact or their involvement in their daily life activities. The primary goal of intervention for individuals with PSP should be to minimize or eliminate falls, as evidenced by the positive outcomes observed in the 3 described cases. To finish, early multimodal physiotherapy can improve balance, gait, strength, and functionality while reducing the frequency of falls in patients with PSP. It is very important, as we show in this study, personalizing interventions to meet specific needs, limitations of these patients, and involving families and caregivers are crucial. A multidisciplinary approach is essential for managing disease progression, and we need to have a good communication with their neurologists. In the future, longitudinal randomized control studies are necessary to gain a comprehensive understanding of their impacts on adaptive plasticity and disease progression, and to determine the most sustainable types of physiology for this population. Thank you for our attention, and thank you again for the invitation to be here and to share my work with you.